Hi guys, this is Group 26 and we're going to be talking about Arnica. Arnica is mostly found in Siberia and Central Europe. It is found in temperate climates of North America like Texas and California. Um, it has a lot of scientific names like Arnica montana, Arnica crudifolia, Arnica augustifolia, and so many more scientific names on the slides. It's under the family name of Asteraceae or Compositia, and basically these are flowers that kind of look like sunflowers, kind of has like the image I showed earlier before at the beginning of the slides. Mechanism of action of Arnica. Arnica can be used as an antiphlogistic, antiseptic, anti-inflammatory, and analgesic agent. And also it is to be noted that Arnica is likely unsafe to be used orally, but some studies have actually showed that this can be used for some treatment, but it is recommended not to be used orally. Indication and use of Arnica. Orally, but not recommended. Some people actually use it for mouth and throat inflammation, for surgical implications such as bleeding and swelling. Dentists also use it for tooth extraction, used for insect bite causes diabetic retinopathy, myalgia, and also acidification processes. But also keep in mind this is an unsafe method to be used. It can be used topically for bruises, aches, and sprain, and is also used topically for insect bite, osteoarthritis, myalgia, chappies, and acne. Some also go all the way to use it as flavoring agents in beverages, candy, desserts, baked food, and puddings. Some manufacturers actually use this in air products and oils for perfume and other cosmetics. An example is the shampoo shown at the bottom of the screen, an Arnica shampoo.
For dosing and administration of Arnica, it can be used orally or topically. There are many different dosage forms depending on the condition, but for example, one would be bleeding. You can use 5 drops diluted 3 times daily. It can also be used orally for bruises, diabetic retinopathy, or postoperative pain. In the left-hand corner, there is one example of Cynic, which is a type of dosage form made by Alpine Pharmaceuticals. And topically, it can be used for bruises, exercise-induced muscle soreness, osteoarthritis, post-operative swelling, and post-operative pain. For one dosing example for bruising, you can use 0.25 grams of 20% Arnica, and it is used twice daily. Like I said previously, the dosage does depend on the condition. The effectiveness of Arnica. There are many potential benefits that Arnica has, including the following. It is believed that Arnica reduces inflammation, relieves arthritis, reduces muscle soreness, is an effective treatment for bruising, has analgesic properties, can heal internal bleeding, can treat skin disorders and act as a moisturizer. It can also prevent hair loss and promote healthy hair, and can be a natural treatment for stretch marks, and can also treat stress and depression.
Safety and interactions. So safety of Arnica is considered possibly safe when used in amounts commonly found in foods. This is recognized safe in the United States, but Canada does not regulate that this is allowed or safe in food ingredients. It's likely unsafe to take Arnica orally as it is considered poisonous, severe, or fatal. Some toxic effects include cardiotoxicity, causing a large increase in blood pressure, gastroenteritis, muscle paralysis, increase in pulse rate, heart palpitations, shortness of breath, nervousness, nausea and vomiting, multi-organ failure, increased bleeding, and even death. Toxicity that is severe and fatally poisoning, which has been in the past, it has caused fatalities and can also cause comas as well. Full strength Arnica is not recommended for oral use, and avoiding topical use on broken or damaged skin is also recommended. Interactions. Moderate interactions with anticoagulant, antiplatelet drugs will possibly increase the risk of bleeding. Because of this, patients who are on medications like aspirin, Plavix, Fragmin, Levonax, heparin, and some others, this would want to be avoided as it would cause an interaction. Also includes interactions with other herbs and supplements, including but not limited to angelica, clove, danshin, garlic, ginger, ginkgo, panax, and ginseng. No other interactions with food are known except for the above listed. In addition to interactions, there's also convenience and other considerations. Avoiding the use of Arnica on broken or damaged skin, as we previously discussed, and cross-allergenicity in individuals who are allergic to Arnica and other plants in the family. Some of the common members include ragweed, chrysanthemums, marigolds, daisies, and others. Arnica can also irritate the GI tract, which is going to be a contraindication in individuals with infectious or inflammatory GI conditions. Used cautiously in patients with high blood pressure and arrhythmia, Arnica has antiplatelet effects, which can result in excessive bleeding if used perioperatively, which means that we need to recommend to patients to discontinue at least 2 weeks before elective surgical procedures.
So this is just the summary of what we've discussed so far. Arnica can be used topically for throat inflammation, post-operative complications such as pain, swelling, or bleeding, tooth extraction, insect bites, bruising, diabetic, retinopathy, stroke, and as an abortifacient. However, there's not enough evidence supporting its effectivity or safety. Topical Arnica, however, is effective and safe to use for osteoarthritis, and when used 50 to 100 milligrams applied to the affected area 2 to 3 times daily for a period of 3 weeks as patients show improvements in symptoms. Arnica should not be used with other drugs such as aspirin or herbs such as clove, and patients should follow instructions for Arnica if they want to see improvements in osteoarthritis symptoms such as pain and swelling of both the hand and the knee. And if there are any adverse effects or effectivity is not observed after 3 weeks, the patient should see a physician. Thank you.